Hi everyone, my name is Shashank and this is Lattice, built for the AI for Bharat hackathon. In India today, our healthcare history is still stored in plastic folders. Patients carry discharge summaries, prescriptions, lab reports, often losing them, damaging them, or forgetting to bring them. Every new hospital visit starts from scratch. Doctors don't have structured longitudinal history. Insurance providers process fragmented claims, and most importantly, there's no intelligent layer that connects a patient's medical journey over time. Healthcare data in India is highly unstructured. Lattice solves this by transforming scattered medical documents into a structured, longitudinal health graph for every patient. What does this mean? Every time a patient uploads a medical document, whether it's a discharge summary or a claim, we, using AWS extract the unstructured data. Using Bedrock and LangGraph workflows, we convert that unstructured text into structured medical entities, ingest that data into a graph database, and append it to a growing timeline of the patient's medical history. Instead of PDFs, we now have relationships. Patients lead to encounters, encounters lead to diagnosis, diagnosis lead to claims, and claims that tie up with hospitals. Over time, this builds a living health graph that has three major impacts. Firstly, for patients, they get a one stop digital health memory. No more carrying files, no more repeated explanations, no lost history. Doctors can instantly see their longitudinal record. Secondly, for doctors, instead of reading a 40-page PDF, they can understand a patient's treatment history in seconds. Faster context means faster and better care. Let me show you the demo now. This is the dashboard for Lattice. As you can see, every patient will have a portal to upload their recent medical history. They can upload a diagnosis or they can upload a medical procedure over here. I have processed a few claims here. Let us look at them. As you can see, for each file that is being processed, we have a document section that shows you the metadata. The JSON output for testing purposes and for the purpose of this hackathon shows you the relationships and the nodes related to this claim. We can also look at it in a graphical point of view. Over here, we can see that there's an encounter. If you click on this, you can see the admission date, the visit type, and the encounter ID. What kind of department did the patient go into? We can also view the patient details from here. As you can see, we are looking at a graph for Mrs. Rukshana. We also see what hospital she went to. She went to a hospital in New Delhi called Human Care Medical, and she was diagnosed with the following conditions. We can now query this graph and retrieve, counter encounter history, diagnosis history, and the total claim amount, the amount of time she visited a hospital, and the following details. The same can be observed in our Neo4j graph. For testing purposes and for the purposes of this hackathon, I've used Neo4j, but in actual productions, we can use AWS Neptune. The entire system is deployed on AWS infrastructure using Docker containers. It is running on an EC2 machine with S3 for storage, RDS for metadata, and a graph database layer for relationship modeling. Looking further, we want to expand the vision. We plan to enable a natural language interaction with the health graph. For example, for example, what is this patient's diabetic history? Show the cardiac related visits over the last 2 years. Because the data is structured relationally, we can perform multi hop queries across time. We also plan to introduce the risk intelligence. If a patient has a repeated medical history or emergency visits for chest pain, the system can proactively elevate cardiac risk and suggest preventive evaluation, moving healthcare from reactive to proactive. Lattice is not just a document processing application, it is a foundation of health intelligence layer built for Bharat. Thank you.